surgery and the post-surgical, kind of what's that process?
Okay, yes. So, at least currently, how they normally stage the surgery is you'll come in one day, or you'll get your surgical consult. As long as you don't have any other comorbidities or complications based on your scans of the brain, then okay, let's say you're a good candidate. You'll go in and you'll get these things called fiducials, which are probably the most painful of the entire surgery component. Basically, they drill in these little, antenna spots where they have to mount the structure to actually place them. That's the most painful thing. That happens the day before you actually have your DBS placement put in. Day of, they basically put about nickel-size to quarter-size holes on either side, depending on the structure where they're looking. If you're essential tremor, you're looking at VIM. If you're Parkinson's, you're looking at STN or GPI. Again, as far as which one is which, that's a whole other topic of discussion. Ideally, they make their pass, they hit it clean, they do a reading on you, intraoperatively. So a lot of people get freaked out because most doctors do the surgery awake, meaning you are awake while they are in your brain. A little scary, a lot of people freak out. However, most doctors, they put you in a semi-sedative state. So it's kind of like you're just relaxed, you're able to follow directions because they are actually testing you. So that goofy, they make you do this and move your hand back and forth. They will do that intraoperatively when they are stimulating the structure in the brain because, let's face it, they want to make sure they hit the right spot. Just because a picture shows it doesn't mean clinically you're getting it. So they do that, you get dialed in, and then sew you back up, everything's good, and then the post-op care is where that varies drastically too. So our clinic, we go right away. You get your brain surgery. Within that same week, you get your IPG, which is your battery and computer. That can be placed in numerous sites. And a lot of the time, it's either the chest or our facility uses the abdomen. And a lot of it for females and comfort, it tends to bother people up in the chest area. So we tend to move it down to the abdominal area, and it seems to work a little better as far as comfort. There's some new tech coming out there in the future, hopefully, smaller batteries, stuff like that, where hopefully it'll be less of an issue. Other facilities, they will wait 4 to 6 weeks after your surgery before they even touch you. Like I said, we jump into it week 1 and we chase your swelling and try to get you dialed in as quickly as possible and at least get you some control, because after all, you just went through brain surgery. So in our mind, why wait?
Yeah, awesome.